What is bruxism, and why is it very much important to realize that you're a bruxist? Now, bruxism is the motion of grinding and clenching the teeth, and this has an adverse effect on the long run of the health structure of the tooth. Now, we tend to see many patients in our clinic often complaining of muscles in their joints, teeth, they're becoming shorter and shorter in time, and this is a clinical sign that the grinding and the clenching is happening there. In some cases, treating bruxism is often not an option, yet preventing further loss of the tooth structure, this is where we come. Now, there are different treatments that we usually apply in those kind of cases, depending on the severity of the grinded teeth. Whether we need to go for a preventive measure by just doing a night guard, or whether we need to go for a restorative measure where we need to restore back what we have lost. I would like to share with you a case that was done in our dental clinic. A patient presented to the clinic with often grinding and clenching his teeth, which led to a considerable amount of tooth structure to be lost. Now, in those kind of cases, we need to restore the full dentition with different designs of ceramic, with veneers, overlays, and crowns. It's very important for these cases to planify them perfectly in order to have a long, successful outcome. Specifically in this case, we can see that the patient has lost some tooth structure in this side, some tooth structure in this side. At the same time, we can see the gums. He has some gum inflammation. This is due to irregular margins of the teeth. Along as well with the lost vertical dimension, which limited the amount of space to be present specifically for the upper teeth. And this causes a huge pressure and load on the front teeth. So, in these kind of cases, we often start by taking pictures, and we often start by designing the smile. And this is where the DSD comes in hand, which is a digital smile design. We send all of this information to my lab technician in order to fabricate what we call the temporaries, or to do a mock-up for the patient, where the patient tends to see his future smile. And we often test in this step the phonetics, the aesthetics. Let's say it's a starting point for myself, the patient, the lab technician, where we can have a future visual of the future smile. After improving on the mock-up and after improving on the design, then we take the measurements and we send it off to the lab technician to fabricate the veneers. In this case, we did a full feldspathic veneers for the upper and the lower teeth. Beautifully ceramic work was done in this case. And this is the final outcome. Now, it's very important to concentrate here how we have altered what we call the height from the top teeth over here to the bottom one over here in comparison with the top tooth over here up to the bottom over here. How we gained extra space. And this amount of space was the space that was lost over the years due to the grinding and the clenching habit that the patient had. And this, of course, was restored for all of the upper and all of the lower dentition as well. Restoring back a better function, better eating, and most importantly, reducing the stress and the load on the muscles. And this was the final outcome, the before and after. So it's very important whenever you feel that your teeth are getting shorter, whenever you feel there is a muscle joint issues, it's very important to adjust to your dentist, to go directly to your dentist and to see what is the main issue over here, because we can always start with a preventive measure by giving an occlusal night guard, by adjusting the occlusion, the bite, in order to reach to a point where we need to restore the full dentition.